Well, welcome everybody to our live chat where we're going to talk about Osia and PIER. We've wanted to do this for a long time, and there's a lot of great updates and really good information I hope you're going to learn today. So I have a few friends with me to help me get all this information out to you. So why don't you guys go ahead and introduce yourselves?
Hi, everyone. I'm Tiffany. I am Dr. Lewin's Microtia patient liaison. I also have a son who wears bilateral Cochlear Baha 6s on an abutment. And so I am again super excited about this live chat because I love learning about the Osia and all the new advancements that Cochlear is doing for our kids with bone conduction hearing loss. And I will just chime in if there's some things we want to, go over during this presentation. Let's keep it super casual and a little bit more of just a communication style. So if I do interrupt you, I apologize in advance.
Awesome.
Thanks, Dr. Lewin and Tiffany, for having us. I'm Amanda Sweet. I am an audiologist and I work for Cochlear in Southern California. I do a little bit of both clinical support and surgical support. So just out here in Southern California in surgeries with Dr. Lewin and other Osia providers, and then in the clinic with the audiologist and helping to support them with programming and learning about our new technology, just like we're going to do today.
And I'm Jeff Carroll. I'm a PhD biomedical engineer. I have a background in hearing devices, clinically, research, and in industry. I support Cochlear's bone conduction business in Southern California, and I've had the pleasure of joining Dr. Lewin in surgery for a number of her cases.
Great, thank you. All right, we're going to dive in. I do want to give a very special thank you to Cochlear. I've been using Cochlear way back from the beginning of my practice. I don't know, more than 15 years I've been doing that. I've been in practice for about 19. And it's been a really great partnership, and I've just enjoyed tremendously watching the technology continue to improve year after year. This company is striving to get better sound for the patients I treat, my Microtia atresia patients. So it's been wonderful, and I've gotten to work with Amanda for a number of years and really enjoyed Jeff more recently. So we'll jump right in, and I want to start with a little bit of a historical perspective. The very first Baha bone-anchored hearing devices actually started in the 1980s, and there's been several generations where the surgical components have had improvements over time, although maybe 2011 was the last time there was a change to the implant that we use surgically implanting into the skull. The processor on the outer portion has changed over time as well. But you can see this, piece that goes on the outside. It's both a sound processor and a transducer. So that's an important understanding, because it's collecting sound, the sound processor part, but it is transducing or vibrating, as you guys notice, vibrating those sound waves, converting them into something that can be transmitted to the bone. And the way that they transmit is through this abutment. And this was sort of the first generation of Baha, where that abutment popped through the scalp. So there was a metal snap. And as Tiffany pointed out, her son's still using that with Baha 6s today for his hearing solution. And then that is screwed into the implant. That implant is the part that has remained the same throughout all these years, and that's sort of the real bulk of the surgical part of this process. So in 2013, there was a nice advancement because there were so many problems with that abutment, getting infections or drainage, crusting, overgrowth, meaning the sort of scalp skin kind of grew over that and made it painful or even impossible to use the hearing solution. So the Baha Attract was a nice solution because it eliminated the abutment, and then the connection was just with this magnet. However, basically used the same processor, and the quality of sound was very similar to what kids were using with a softband Baha. So it was, sort of a softband hearing level without the actual band. So it was convenient. And when you removed it, you had no idea there was anything there. When you put it on, you could hear similar to a softband. But of course, we wanted to do better than that. The Osia came around in 2020, and I have to say that, I have seen this be a game changer. And what I really want, I guess, patients to understand is how different and groundbreaking this technology is. And what you see here in this picture is the only part that's on the outside. So it's sort of like you took a Baha and you smushed it, and it's now skinny and a little bit wider, but it is not the same in that it's only collecting sound. So it's the sound processor part, but without the transducer. And what's now what I call the motor or the engine of this hearing device is internal, completely underneath the scalp. And that's the piece you see here that we refer to as the Osia. And we'll go into the details of how it works a little bit later. But I did want to just make 2 points with this slide. If you chop these in half and you look at a cross section, that's the architect in me that wants to do that. You can see that they sit off the scalp at different heights, shall we say. So low profile versus higher profile, the most high profile being the magnet, the lowest profile being the Osia. Jeff or Amanda, can you tell me, like, how many millimeters does that stick off of the scalp?
It's about 3 to 4 millimeters that it comes off of the scalp with the Osia.
Okay, so incredibly tiny and close. For comparison, let's say like the newest generation Baha 6 that Tiffany's son is wearing, how much millimeters would that stick off of the scalp?
Say, Jeff, I don't know if you know off the top of your head. It's been a minute, honestly, since I did a Baha.
To be 100% correct, I'd have to go back and look. I want to say it's about 13 millimeters for our low pro version, and then 15 millimeters for the extended snap coupler. So even that 13 millimeters is like the really skinny version of what we have in the Baha now.
And it's already, 3 to 4 times
more than double, yeah.
So that's a nice detail, but the second point that I think is really critical, and this sort of has to do with why I'm implanting all these systems at the same age, which is 5 years old, is because they all use identical surgical components. This implant that is seen in all this pink circled areas is identical for each of these devices. It's just, what do you screw into it? One of these 3 solutions. So to me, that's kind of brilliant that they're keeping that, which has worked so well, for all their systems, because it also means, in some cases, they may be interchangeable. So here's an example of our 5-year-old patient. And this is Simona. She had surgery about 8 months ago. She was born with grade 3 microtia and oral atresia, and she wanted to get both a 3D ear and an Osia. So you can see here after her surgery, when her hair is down and looking adorable, you really don't notice that she's got a hearing solution. And I think it's impressive that there's a little tiny fish line clip to the clothing, which also is, of course, conveniently hidden by her hair. But even with her hair up, yes, you can certainly see the device, but it's not quite as high profile as some of the other devices. And, I think in essence, this is really just being able to take this off and have nothing there at all, and no evidence that you have a hearing aid when you don't need it, has really been incredible. But the thing that's sort of most exciting, besides the surgical advances, of course, is when Cochlear, Amanda and Jeff talked to you a little bit about, how much better the hearing is when you separate the sound from the transducer or from the motor. So here's a very rudimentary, simple schematic of how we do the surgery. So this little figure on the right-hand side of the screen, we're calling a skull. So that's bone right there. And we use a drill for drilling a very small amount to create the site for our implant to be placed. And that's delicately screwed into this implant site. It's very tiny. The width only 5.5 millimeters, half a centimeter, and the depth is only 3 to 4 millimeters. Most of my patients, especially younger ones, is only 3 millimeters. And if you think about what size that is that we're drilling, it's basically smaller than the size of a pencil head. Thank you, Amanda, for that. So next you have, or the surgeon has to create a space or a pocket for this Osia to fit into. And this would be behind the ear, and you move the soft tissue out of the way so you can make this pocket. And then what you'll see is the transducer is this silver box at the bottom. That's what we're calling the motor. And the magnet at the top is just what is required to hold the sound processor on. So it's centered up here, and the most recent Osia has a change in the magnet design that, again, Amanda and Jeff will go into in a little more detail, which makes it very advantageous that you don't need to remove the Osia and you can still get an MRI. So again, that was an exciting, relatively new advance. So this circle, pink circle here, is where the Osia device is screwed into the implant, and it's that simple. We screw, at a very precise torque, shall we say, this Osia device into that implant. And then we allow all the soft tissue to cover it. So in our kids, there's fascia, sometimes there's a little muscle, there's the subcutaneous fat under our skin and hair. All that covers your Osia. So although you can feel the Osia if you're trying to, you really don't visually see it. The only part that's on the outside, again, is this microphone that's collecting sound, or the sound processor, and that's got a magnet in it. And there's different strength magnets that we use depending on the patient. And that allows us to have the Osia close enough to the transducer that there can be a digital link. Again, that's the exciting part. It's not vibrating at all. Unlike the Baha that had that transducer vibrate, the sound processor is digitally sending its signals to the transducer, and that takes away or eliminates, the bulk of feedback, which is that very annoying sound that anybody that's had a softband Baha or even a Baha that's surgically implanted has to deal with, is that feedback. So in and of itself, that's pretty great. You can also do cool Bluetooth streaming and all that fun stuff for music and the other good stuff that, again, they'll get into more detail later.
Actually, Dr. Lewin, if you don't mind, could you, or Cochlear, can you explain I think you'll touch on the MRI compatibility later, but just the naming, because I incorrectly said the Osia 3. So could you just quickly explain, since we've kind of walked through these generations of processors, what the newest model is called? Because I think a few of us parents, even online, misname it.
Yeah, of course. So the implant for the Osia is on its 3rd generation. The 1st generation really was more for research and used outside of the US, but then the US was the first to see the 2nd generation, what we call the OSI 200 is the technical name. And now, August 2023, the FDA approved the OSI 300, and we started to see Dr. Lewin and other surgeons implanting those early in the fall. So OSI 300 is the 3rd generation internal implant that she's using. And like she said, it's built on top of that same little foundation or screw that we've been using for decades. So lots of history there. And then the sound processor is now called the Osia 2i. And the I stands for imaging. So it's kind of a little fun fact that it's the new MRI compatible device when it has that little I behind it. So we really didn't make big changes in how the processor works. If you had a prior generation Osia 200, you would essentially have the same processor, just with the new MRI magnet in the 2i. So hopefully that's.
And if you have the Osia 2 and need an MRI, then you have a special wrap, or?
Absolutely. So if you have the OSI 200, the prior generation that Dr. Lewin was using before, say, October, then you would get the Cochlear head wrap or MRI wrap. And we have a ENT or surgeon that works with the Osia who can place that wrap prior to your imaging. You then can have an MRI up to 1.5 Tesla. So what's so great about the new version is you don't need that head wrap, and you can have an MRI up to 3 Tesla. So a bit stronger machine, and it's completely safe without any sort of head wrap.
Okay, and then I know a very popular question online too is if, now if we actually get to a real Osia 3 per se, do people need surgery for technology advancements, or if they want to upgrade processor when the next one comes out, how does that work?
Yeah, that's a great question. And especially, I kind of want to touch on that too with the new one, because we do get a lot of people asking us now with the OSI 300 out and the Osia 2i, oh my gosh, should I upgrade now? And, so to your question on upgrades, Cochlear has a history of never leaving our patients behind. When we come up with new technology, we always want to make sure that it's backwards compatible to previous generations. So even like if you look at our Cochlear implants going back to the 80s, when we come out with a new sound processor, we always try to make it compatible with, every previous version. So the implant itself, the OSI 200, the OSI 300, they're designed for a lifetime of hearing. We're hoping that never has to be replaced. Most of the technology, the cool sound processing, noise reduction, things like that, happen in the processor. And so if, our average has been historically about every 5 years, we come out with enough of a change that new technology will be noticeable. That is always intended to be compatible with previous generations. So then to the point of Osia 2 versus Osia 2i, those are only compatible with their implant. So the Osia 2 is an OSI 200 implant. The Osia 2i works with the OSI 300 implant. So if somebody had the Osia 2, getting an Osia 2i would not work with their implant, but there's also no difference in terms of sound processing, noise reduction, feedback management, any of the technical aspects. The only difference between the two is the implanted magnet and the MRI compatibility due to that.
Okay, great. And one last comment quick, just because we were talking about feedback, because I know like the Baha 5, the Baha 6 can have, more feedback. What happens, kind of my own curiosity about like hats, winter hats. It's -11 here today where I work and remotely from Wisconsin. Winter hats, are really a struggle with the Baha, even with lots of workarounds or, helmets or, can you kind of address a little bit of feedback with some of our pediatric patients, and what they typically ask about is usually like hats, bike helmets, baseball helmets, things like that.
Yeah, absolutely. So with any sort of bone conduction device, with that engine and that movement, there's always a chance of feedback. But with Osia, it's virtually eliminated, especially just wearing it day to day. You really it's very rare that we see any sort of feedback. Now, putting a hat or a helmet over the top, of course, we could always expect there's a higher chance of feedback, but compared to a Baha or really any prior generation bone conduction device, significantly less likely to get feedback. So we do see a lot of patients who are able to wear a hat or helmet. Of course, some other considerations there, like exactly where does the Osia end up being placed? How tight is the hat or the helmet? So you might have to get creative or try a couple different types or styles to find the one that works the best for your child, but significantly better and less feedback with the Osia device.
Great. Thank you. Sorry, Dr. Lewin, go ahead.
No, those are excellent. That's great, great information. What age can the Osia be done? This was, seemingly a point of confusion when the Osia first came out, not to physicians, but certainly to patients because of, well, a little bit of maybe politics more than anything, but this is the issue that caused the confusion. So the Osia was approved by the FDA for 12 years of age. And my understanding is the reason that was done is because there was a pre-existing, somewhat similar device that already had FDA approval for 12 years. So it could almost like fast track the Osia to get approval so it could start being used. Now, maybe, Jeff, you can let me know, many other countries, because they didn't have this pre-existing issue, approved the Osia right away at 5 years of age. Is that correct? And where was that?
Yeah, so as you sort of said there, every country has their own regulatory body. So in the US, it's the FDA, Canada's Health Canada, in Europe, it's CE. So they all have their own requirements, and some are very similar to FDA and some are different. FDA has their process that you talked about, which had led to the 12 years and up. Health Canada, so Canada is 5 and up. Europe, all of Europe that's governed by the CE mark is 5 and up. And a lot of South America, I actually don't know country by country, but I know that Colombia actually has a lot of Osia patients, and their body is also 5 and up. So we see a lot of pediatric patients in South America.
So there's a lot of data, and I think isn't Cochlear certainly studying age of using the Osia as well, I believe?
Yes, absolutely. I'm happy to say that we are always looking to expand who can get our products and how well they work for those patients. We do have an ongoing study looking at ages 5 to 12. Our Baha products have always surgically been 5 and up. And so we'd love for Osia to have the exact same indications, surgically 5 and up. So looking at that study of 5 to 12-year-olds, we have completed data collection, and we're hoping to be able to share an expanded indication at some point in the near future.
Well, that's perfect. And, the nice thing about being a surgeon is these FDA approvals are, they're not the law. It's what the surgeon believes is indicated for the patient. So many surgeons, we do what we feel is best and safest for the patient. And as I tried to explain before on that prior slide showing that all the Baha and the Osia surgical portion of the case is identical. So from the standpoint of most ENTs and plastic surgeons like myself that do these surgeries, we saw no problem with starting with 5 years old. I think the initial concern might have been coverage by insurance. And, for all the Osias I've done, we just have not found that they are approving, I should say, pre-authorizing or pre-approving that the Osia can be done no matter what the age of the patient we've requested. And we've requested, or the bulk of my kids are probably in the 5 to 7 year range that we're putting the Osia just because, that's who's coming in the door. But we certainly have older patients too.
I think that was such a important thing to touch on because I just see that confusion online constantly. So I'm glad that you could really explain that and clear that up. And it's exciting that, Cochlear is doing that study that, hopefully will be out soon to just further clear that up a little bit.
Yeah, I agree. So the next question we find really is asked a lot, but it's super important that you understand is what is coming first, the ear or the Osia. And the Osia preferentially can be placed at the same time as the 3D ear, and we can do it with no additional scarring, which is really exciting. Or it could be done anytime after. Let's say you're not sure that you want to do the Osia just yet. You know you want an ear, but you're not kind of ready to commit to the surgical hearing device. Maybe your child's doing great with a softband, or maybe they, at this point, don't want a hearing device. That's not a problem, and it couldn't be done after. And if the anatomy was typical, it could even be done locally by your own ENT afterwards. However, there are some reasons that you might have to come back to me for the Osia placement that have to do with the anatomy. And to briefly go into it, you know, if your typical flap that covers this ear implant lives up here above it, every now and then we have a reason why we may not want to take this artery and we go back here and we grab a different artery. And if we grab in here, you can see that, you know, when that flap comes over, it's kind of right in the way of where the Osia needs to be placed. And so in those cases, just in an abundance of caution, I do not place the Osia at that time. And then we come back 6 months later, I go in through the exact same scar and I can place the Osia very carefully, protecting the ear. So in those cases, we would want you to come back to me for that. But if everything went as routine as we normally do, then no. The sort of illustration why we don't want this hearing device placed before you get your surgery can be shown with this patient. So this is a little boy, young boy with grade 3 microtia and oral atresia. And this is where I want to place his ear. And this is the flap that I'm planning to dissect in order, the more typical one, the one that's right here. That flap, if you figure that the Osia is going to be placed behind the ear in this position, you can see that the Osia itself is covering a portion of the flap. Well, that edge contains an artery that I need. So if someone else goes in to do the Osia, they may inadvertently injure that artery or the tissue, and then I won't have enough to cover the complete implant. These 3D implants have so much like detail and definition now that you need a bigger flap than we used to do in the past. So that's why it's kind of encroaching upon where the Osia will be done. So here's an example. This boy, after a year after surgery, has his ear in place, and this is where the Osia would be placed. Now, if I'm going to do the second surgery, let's say, because for whatever reason, let's say we didn't do it the first time, and I'm going to do it in a second stage, I use the exact same incision that we used to make the ear. So it can be done with like no additional incisions. And the key, it's a lot harder to do it this way. And this would not be the way Cochlear teaches their doctors to do this operation. But I do it because I don't want any scars in hair-bearing scalp. And it's because as soon as you make a cut in hair, that will forever be a scar that doesn't grow hair. And like this little boy who wears his hair very short, I don't want to see a crosswise scar, you know, that doesn't have hair. So you could go locally, and they probably do make somewhat of an incision into the hair-bearing scalp. And if that doesn't bother you, you by all means can have it done locally. If you particularly want a scarless Osia, again, that might be a reason you would come back to me. I do want to talk a little bit about sort of the breakdown of hearing solutions in my practice, because, you know, it's been so interesting to note since 2020, when the Osia came out, there's like a increasing trend of Osia, decreasing trend of Baha and canals. So my practice, it's pretty much the same year over year. So we did 99 3D ear implants. Roughly half of them are international. So the internationals, to this point, we were not offering any Osia to because those patients didn't have support for the Osia, or certainly for the, you know, potentially the newer software and such. So of my 99 patients, 52 were from the United States and what I would call like eligible for getting an Osia. And this is how it broke down. So 23 or almost half chose to get the Osia. And we had one patient that chose to get either the Baha or the Ponto. I don't remember which one, but that's still an option because in some cases, a patient may prefer an abutment. And maybe Tiffany, you can speak a little bit about to this point.
Yeah, I mean, my son has, the bilateral Baha sixes, and at age 17, he's like a power tumbler and dancer who is constantly doing like triple backflips and whatever. And so I'm just a little concerned as he's kind of ramping up his dance career for him specifically of, a magnet of any kind on his skull. I just can't like risk it right now. But I definitely see an Osia in his future. We're still kind of battling the whole abutment thing here and there. Like we just battled it a month or so ago. And even though he gets extended abutments, you don't want to extend them too much because then they stick out even further than how you commented. But the magnet, I mean, not only the sound quality am I looking for, but just, the magnet versus the abutment issues. It's really, exciting. But right now, while he's flipping, we all can't flip forever. So while he's flipping, we're going to stick with this. But, it's definitely on my radar, and even all the girl clips or all the clips I have with the hair clips and the different clip solutions that, we have a lot of dancers with Osias that do just fine. So it's on my radar, but right now it's just not for us.
Yeah.
And maybe that's where I'd add into, Tiffany, you mentioned it, like there's different retention options with the Osia. So there's hair clips. And of course, for girls with longer hair, sometimes they even use their hair to secure the Osia, kind of pinning it under the hair. And there's a headband that they can use for sports. But again, like the willingness of a teenager to wear a headband can vary, and depending on, again, if it's part of their sport and they'll look like everybody else wearing a headband, they might be more open to it. But if they're going to be the one person, maybe not as open to it. So I think that's a great example. But definitely some different retention solutions, because parents ask that a lot. Like, what can my child use to help keep it on during different activities or sports?
So just continuing on with like what we've seen in this past year, I didn't have any Bonebridge patients. It is indicated or FDA approved in the United States. However, I only have actually one patient I'm aware of in my practice, and that's an international patient. So I don't think that's commonly done in my experience. I think also compared to the sound quality you get from an Osia, I think, hands down, as we'll talk about in a little bit, the Osia really leads the league in hearing solutions.
Sorry, do you mind talking about, like, because people will ask if you do implant the Bonebridge, and I know that you don't or won't, or can you explain that as well?
So the Bonebridge is has a lot more intensive surgical procedure and carving away a lot more of the skull bone, and it's much larger than the Osia, and it doesn't have as good of sound quality, but that requires an ENT, probably particularly an otologist specialist to do, and it could only be done after the ear. If you get a Bonebridge done first, it will destroy all the tissue I need to make the ear. So you would no longer be a candidate at that point. And then of the 52 patients that were, essentially like candidates for hearing solution, 5 of them came to me with a pre-existing canalplasty. Some of them, I think 2 had failed canals and got Osias for their failed canals.
So, and Dr. John, how much do you love canalplasties? Oh, I'm just kidding.
Surprise here, but I'm not a big fan of canalplasties, and it's of 19 years of following these patients and seeing kind of all of the risks. And really the most heartbreaking is like when you get sound, at 1 year, and it's very exciting and everybody's celebrating. But then, several years later, that sound is, decreased and not enough of what the child needs to get by, and potentially is even worse than what they started with. Sadly, I know your son, Tiffany, had 2 canals, and they, ultimately his hearing was worse and they both had to be closed. And again, data like that just is nowhere to be found for these parents trying to learn about canals. But I know all those patients that had to get their canals closed or that their canals failed. And at some point when like the scale tips so far in one direction, it just in my mind as a surgeon trying to advocate the best for my patients, and I can't really endorse something I would never do for my own child. I guess that maybe is the way to say.
Well, and I think, you always use the word like predictability, like the Baha, the Osia, it's just so predictable. And the chance that, the risk is just so reduced in comparison. So I just think that's such an advantage. I would think even as a surgeon, like saying, advising your patients on something that's super safe and predictable with a known outcome.
It is just that. I mean, there are some risks with Osia, but I think like in the first year of using them, I kind of like figured out the tricks to really minimize those risks. And, now they're going very much quicker and seamless and without problems, and so reliably get you wonderful hearing. And there's actually no contest on the hearing quality. I don't know anything that can do as well that's available, at least in the US, as far as I'm concerned, that can compare with the Osia. And most specifically, the Baha and the canals are not great at getting high frequency sounds into the bone. And so the Osia just opened up a world of hearing to these kids that they've never heard before. And Tiffany's interviewed some of our Osia patients, and they're like, I could hear like the flapping of wings of a bird as it flew by, and things that are just kind of crazy. You and I, were an insect noise, like not that we really want to hear that, but
yes, I think one patient said they didn't realize when they opened a textbook, like the pages made noise.
Oh my God. Yeah, like those little moments, and the fact that there's now this very predictable, reliable product that can get a kid those moments, like that's, pretty special in my mind. To just look, so since Osia came out, obviously, like we kind of ramped up. We've done 65 in our patients. And just this past year, we did 23 Osias. The breakdown is 13 of them we were able to do at the same time as the 3D ear. And then 10 we had to do after the ear reconstruction for almost always an anatomy issue. So for instance, if you have Treacher Collins and you're going to get 2 Osia, we're going to do those bilateral Osia as a third stage after we have a totally healed first ear and a totally healed second ear, because that anatomy is so challenging just to get the ears, to work. And we almost always have to do like a tiny little revision here or there. Then these 23 Osias, those are amongst those 52 patients that are candidates for them. Several Osias we placed after failed canalplasties. I can't remember if it was 2 or 3 of the 5 that came. And then breakdown of Osia de Ponto is about 98% to 2%. And age range 5 to 37 years. So 37 is the oldest. And really, a lot of the reason that patients don't opt for an Osia when they're a candidate, the primary reason in my practice is actually they've never used a Baha. And, like the first time they try one, they're like, oh, this is weird to me. I'm not used to it. I don't think I'm ready for this. And so it's on their radar that maybe they would do in the future, but parents aren't ready to commit, at the time that they're getting their ear, that they want that solution.
So I have a question on the bilateral. So you would do, like, on a second stage surgery, you would do, I know you don't do like bilateral first stage ears at the same time, but would you do bilateral Osias at the same time?
Yeah, we actually recently did one in a patient. I think, Jeff, you may have come to that case.
I was there, yes.
Little Annie. So she might have been the first or second patient I did bilateral Osia. So yeah, if you have an anatomy issues that make me feel like I don't want the Osia in my way, if I have to go back in to do a second stage, or there's things I can do and then put the Osia to second stage, I will often tell a parent that either pre-op, if it's obvious to me then, or intra-op, we explain to everybody, if we have an anatomy surprise or it's not typical, we are going to do the safest thing, which is do the Osia in a second stage later. Should I hand this over to Cochlear, and then I'm going to stop sharing my screen?
Yeah, I'm going to pop up. So we're going to take a little bit deeper dive into some of the Osia technology, the changes with this new OSI 300 that just came out this fall, and then talk a little bit about those hearing outcomes that Dr. Lewin alluded to. As a audiologist forever and ever, of course, very exciting to see the hearing outcomes. We always joke that Osia is like if the Baha Attract and the Connect, the abutment, had a baby, but it's somehow an even better looking baby. So exciting in the audiology world to see what we could achieve there. With that, I'm going to hand it over to Jeff to kick us off and talk about the updated Osia system.
Thanks, Amanda. So Dr. Lewin did a really nice job of walking through all the different parts of the Osia. I'm basically just going to recap and show some of those as well. It'll give us just a couple different views, a couple different images to show some of the things. So you can see here we have the two components, two main components of the Osia plus the implant. So starting up at the top here, the white piece, that's our sound processor. We talked about the model numbers. So this is the Osia 2i, our most current, that goes with the OSI 300 implant. The parts of the implant that we're looking at, where the sound processor attaches, that's the magnet. That's how all the sound information gets into the implant, as well as the power. Sometimes people ask, is there a battery inside? The only battery lives outside here in the sound processor, and then that's communicated through that digital link that Dr. Lewin talked about. Down at the lower left side here, that shiny silver box, that is the transducer, or what we talked about is the engine of the implant. We have a nice little graphic we'll show on the next slide, but you can kind of see this opened up view here in the circle that shows how this works. So the kind of beigeish material, that's that piezoelectric material. We talk about piezo power being better or more efficient than the older technology, which was electromechanical. And basically, how piezo material works is when the electricity is applied to it, it vibrates. And then, so on the side there, those two shiny silver blocks, those are just tungsten blocks. They're weights that vibrate, and that's what creates the vibration sound that the patient is able to hear. So this is a nice little video of it in work. We call it like the butterfly effect. Here you can kind of see it. Obviously, this is moving much slower than what happens in real life. But again, this is the heart of why the Osia is able to have such good sound quality, and especially at higher frequencies. And Amanda has some great data on that a little bit later.
And I'm going to add here too, Dr. Lewin alluded to it when we talk about like the engine here, the transducer. that when Cochlear was innovating the Osia and looking to create an implant we could put completely under the skin, except for the sound processor that collects the sound, we decided not to simply take the engine of the Baha and put it under the skin, because as she mentioned, it's that high profile, and it also has a lot of different moving parts inside that we would worry could break down over time, which isn't a big problem if you can just swap out a processor with Cochlear, but if it's under the skin would require a new surgery. So we really wanted to design a completely new kind of engine with this piezo material that you're seeing in action here that would be really safe, and be able to, like Jeff said, provide a lifetime of hearing to your child. So we want them to have one surgery, one implant, and have a really reliable implant under the skin. And again, that low profile of this material was really important to be able to implant it in children. So this is a really nice view and a little bit about why Cochlear developed a completely new kind of engine for the Osia.
Well, and especially when it comes to MRI, don't move ahead yet, Amanda,
Okay.
but we focus a lot on the magnet end for MRI compatibility. And as we talked about in this talk, the OSI 200 was compatible with a head wrap for MRI at 1.5 Tesla. But what doesn't get shared a lot or enough, in my opinion, is that without a magnet, if you were to take the magnet out of an OSI 200 or OSI 300, the Osia body, the part that we're looking at right now, has always been MRI compatible all the way back to the first generation, because there's no magnetic components. None of these pieces of metal that you're seeing are magnetic or ferrous metal. It's titanium and tungsten. So this has always been MRI compatible, which means you put that into an MRI, it's going to function the same coming out of the MRI as it would have going in. On an electromechanical system like the engine that drives the Baha, you clearly can't wear a Baha into an MRI. But even other systems out there that are electromechanical in nature have magnetic materials as part of that engine. So even if it's MRI compatible, we still don't know what the output is. MRIs have significantly strong magnets that affect other magnets, and you just don't know if your output gain will be the same, or the performance, or even if that device might fail, even if it's, again, compatible. But the other end, the magnet end, if you want to go ahead and advance a slide, this is where the change to the OSI 300 relative to the OSI 200 is. This was the change to the magnet. So what we see here, the OSI 200 magnet, they're both basically the same strength magnets, same position. They're just designed differently, and it's the orientation of how they put that north and south on the magnet. What happens on the new one is when you go into a magnetic field, the magnet can actually just rotate to align with the magnetic field, like you see the graphic happening here. And it just means that you're not going to get any force trying to pull against that magnet. On the OSI 200, an MRI field might try to pull that magnet out of place. So this is what allows us to have, the first and only active transcutaneous system with conditional usage at a 3 Tesla MRI. So I'll go ahead and pass it back to Amanda to talk about some of these performance measures.
Thanks, Jeff. Any questions before I jump into some of the audiology and hearing outcomes?
I don't think so, but you can tell you have a lot of smart people working for you.
We're all a bit nerdy, I think, is what it comes down to, and love what we do and are passionate about it.
But I love that you're taking like feedback, or you just continually want to advance things for the patient, because the MRI compatibility, like nobody really expects their kids ever going to get an MRI. So it's not like, people weren't
like Dr. Lewin mentioned, Osia is really a game changer in the world of ears and hearing. It's kind of sad that we launched Osia at the very start. I mean, we launched in February 2020, so it was overshadowed by what was going on in the world with the COVID pandemic, because it kind of killed the buzz and excitement, and like we really didn't see patients getting implanted until maybe a year later when the healthcare world started to go back to normal. But it really was a game changer when it first came out. It was very exciting, even working for Cochlear. I don't think it was on our radar of what was coming. But from a hearing perspective for your child, a lot of you are probably going to be transitioning from a Baha or another device on a softband. So this is a really great way to start providing, even babies access to sound for their speech and language development before they have a surgical device placed. But like Dr. Lewin mentioned, the challenge is that we're having to send that sound signal or that vibration through the skin and the hair. And so it's dampened down. It's just like if you were trying to talk underwater, that signal gets dampened down. So you can see what a huge improvement your child's able to see going from an unaided, so this is even without their softband, so typical kind of hearing of a child with microtia atresia, for just that ear. So say they have one ear that's affected, or if it's both, then we're looking at both ears, but they may only get less than 10% understanding of words, especially for very soft speech. So on the left, where we have that 50 dB at the bottom, what we're talking about is softer speech. And then on the right, where we see 65 dB, is going to be more conversational speech, like I'm talking now, a little bit louder. So very soft speech is very difficult to pick up with their degree of hearing loss. And so maybe less than 10%, but with an Osia, we're seeing an improvement of over 60%. So they're typically achieving about 70% understanding, even with very soft speech, and that's just with their one ear. So of course, we're typically listening with two, and they may do even better combined. With the more average conversational speech, they may start around that 35–40% of understanding, but we're getting up to over 90% understanding with the Osia device. So a huge improvement. And we talk a lot about speech understanding and the percent they can understand, but something important to remember for a child is the energy required for them to listen. So with any degree of hearing loss, or even with a softband, they are going to need to work harder to try and understand, especially in noisy environments, which, as we all know, I think a child is pretty much always in a noisy environment, often created by themselves, but especially in schools and their different activities, it becomes even more challenging and energy draining to listen with any degree of hearing loss. So just to see the reduction of their listening effort is so great. And that can translate into, even reducing any sort of behavioral challenges that you're having because of that listening fatigue. And how do we do that? How do we achieve that really excellent hearing with Osia? So this is an exciting graph because we're actually comparing the Osia to our Baha 5 system on the abutment. So this is comparing kind of the gold standard in bone conduction before Osia, and now that we have the Osia device. So Baha is still an excellent system. It's especially great because we have some patients have certain reasons that they're going to move forward with the Baha versus an Osia. But with an Osia, we really can deliver over 12 dB more gain on average. So a huge difference when it comes to audiology in the amount of high frequencies that we can give a child. And what that means, the high frequencies are your high pitches of speech. So like S, F, T, H. When you think about somebody whispering or talking very softly, it's going to come through as a higher frequency signal. And just some of your environmental sounds, I think earlier we mentioned, like it doesn't seem like something important, but those little things like turning pages in a book, or the birds chirping outside, or see even a siren coming from a distance, being able to pick those up, especially at softer levels. And what we saw with Baha is that because of that motor and the way that it works and sends the sound, after about 4,000 hertz, so kind of this high frequency sound in the middle, we started to lose power. But with an Osia, we actually see an increase in power as we go up to those higher frequencies, helping your child understand more easily in background noise, or again, with softer sounds. So really exciting to see that even over the prior surgical option, we are seeing an improvement with Osia for those high pitched sounds.
And Amanda, if I can actually add, oh, go ahead, Tiffany.
I was just going to say, like, for those of our viewers with younger children who are just kind of new to the hearing loss world, they might not understand this 12 and 17, but those are enormous numbers.
Like, so a good example even is we consider if a child can hear a sound when it's played very soft at 25 decibels or below, it would be considered kind of that normal hearing range. You know, most kids have very acute hearing when they're young. But if you think about it, like we're able to change at some frequencies like 17 dB, like that's the difference between, you know, normal hearing and a mild hearing loss. So even with the advancements in the surgical solution, it's like we're going to a whole new category of their hearing ability at those high pitches. Does that help to kind of understand too?
No, definitely. It's really incredible and I'm jealous. The other thing you mentioned is the hearing fatigue, and that's something we kind of personally struggle with. And right now we're like about to do finals and we have the ACT, and you know, we have to have accommodations to have testing on different days because the hearing fatigue is real and it's hard to describe, but you know, kids are tired when they're trying to struggle or, you know, they're trying to listen so much harder than you and I have to do every day. So the fact that the Osia could help something like hearing fatigue was never even on my radar. So I'm glad you mentioned.
Jeff, did you have something to add here too?
Yeah, I was going to add, you know, I'm fortunate that I get to go to a lot of patient fittings along with supporting surgeries like Dr. Lewin's, and I love patient fittings because you get to see patients here for the first time. I mean, it's a really rewarding part of the job. And with Baha, I mean, don't get me wrong, I've seen patients that start crying because like they can hear for the first time with Baha, and it's amazing. But I would say that on average, it's a little less super exciting, right? Like it's kind of like, okay, I can hear, and that's good. Whereas with Osia, we're definitely seeing a lot more of the like tears, the super, oh my gosh, I can hear that, like just the real high level of excitement during fittings. And I don't want to take too much time, but I do want to share one story because it's actually one of my favorite. We were fitting a patient, a 13-year-old boy. He had an ear reconstruction. It was actually a rib cartilage reconstruction, which do not look as nice as Dr. Lewin's reconstructions. He didn't like talking about his hearing. He had had that for a long time. And so like if you asked him, hey, how's your hearing? He would just kind of get quiet and not talk about it. And they had convinced the family to go ahead and get him better hearing because he had no hearing in that ear. He would, you know, fake it at school, pretend like he heard people, stop to tie his shoe so that way he could follow, you know, catch back up to the group and put his good ear towards them. And the first time I met him, I mean, he had his hat pulled down low and he was just kind of sitting there, and he wasn't like, you'd ask him questions and he would kind of answer. And then so we programmed the Osia and we turn it on, and I watch him go from like, and he smiled real big and then caught himself because he realized he was smiling in front of people, and teenage boys aren't allowed to smile in front of people. And so he immediately went back, and I'm like, no, I caught you. And he's like, that sounds really good. And when we saw him for a follow-up, he was excited. He talked about his hearing. He would say it like at school, he can just like interact with everybody. And for me, like to get a 13-year-old boy to smile, like that's, you know, light years above, you know, the crying moms when the baby can hear, because we expect that, right? Like I never expected to get this kind of reaction out of him, and that's just I love that story. So
yeah, that's pretty cool. We look forward to watching you go viral on TikTok, Jeff. Okay, with one of these like activations.
We might have to have Jeff's teenage kids show him the ins and outs of TikTok, but we can make that happen. So this is a great close-up view of the Osia 2i sound processor. And we mentioned earlier, it really looks identical to the Osia 2 that would have been used with the OSI 200 implant. So the processors really look almost identical. if your audiologist is working with both, they'll be able to tell them apart by that labeling on the bottom, where you see the purple label is different with the updated processor that goes with the new internal. That I, little fun fact, stands for imaging. So it lets them know that their patient has that OSI 300 or the MRI compatible implant inside, and those two go together. So it's, the purple coloring is different than the prior gray. So there's a couple ways they can make sure to tell them apart. But this really is for the new generation implant. You're going to see there's some indicator lights there up at the top, and we can turn those on or off depending on your child's age. Sometimes parents like to have those indicator lights on to let you know that your child's processor is working, they're receiving sound, and everything's going as it should. But if you have an older child and they don't want, their head flashing green all day, we could turn that light off as well. We have a little control button there, not used too much because I'm going to talk a little bit about the technology behind the scenes. The whole goal is to pop your Osia on and go about your day and not have to make any sort of control changes. We have the two little microphones there. And something important to note is all of our technology has two microphones because we want to be able to help your child hear in noisy environments. So what we can do is adjust whether both microphones are on and picking up the whole environment like a 360 in a quiet room, or do we want to just focus on the sound coming from in front when there's a lot of noise in back? So that's kind of the why behind having two microphones. And then you see the little battery door at the bottom, just like a Baha processor. It kind of swings open for the battery there. And those batteries for Osia, they take a 675, and it has a little special indicator. It's called an implant battery. A lot of hearing aid batteries you can buy at like Costco or Sam's Club. These tend to be a bit more special because they're these implant batteries. So we usually recommend to go on Amazon, look up 675 implant, buy a whole, you can even buy a year's supply. Typically the expiration is a few years down the road. And the typical battery life for Osia is between about 2 to 4 days. It can vary depending on how thick the skin is over the Osia, how much power is needed, how much streaming that child is doing to other technology. So about 2 to 4 days. And that sounds like a lot, but we'll reassure you that each battery is, maybe about 50 cents. But in total, we usually see like average battery costs in a year to be between $70 and $90. So hopefully that gives you a little reassurance that if you hear every few days, the battery may need to be changed, that they're pretty low cost batteries. And then we have those little holes on the side for safety lines when we talked about different retention options. We have little hair clips, shirt clips. There's a headband that comes complimentary that we can just kind of drop the Osia into, and it looks like a sports headband. So several different options there that the audiologist can help with finding the right one for your child. And some kids don't use a retention option at all, especially after a couple of weeks, they get comfortable. Something else I'll mention with that magnet in the sound processor is we have 4 different strengths. So 1, 2, 3, and 4. For a lot of the younger kids that Dr. Lewin is implanting, we're going to be recommending a 1 magnet. So the strength is really equal to the thickness of that flap or that skin that's over the top of the implant. And parents always wonder, well, why can't we go to a stronger magnet so it stays on, no matter if they're running around and flipping around, doing somersaults, is we really want to protect the integrity of the skin right there. So anytime you have a magnet on the outside and then a magnet on the inside, it will compress that skin a little bit. And we want to make sure we're not using too strong of a magnet to cause any irritation of that skin. So younger kids typically recommend like a 1, and as they get older, they might need a stronger magnet.
I think that's a really important point, and I try to make that point when in our post-op visits that what an audiologist may not understand about the Osia for your child if you had surgery with me is we take a layer out, which is the fascia. So the Osia, it is a thinner skin envelope covering that. And so I'm very, very cautious that parents are looking at the skin, removing the ossia, checking the integrity of that skin, seeing if it's getting red or not. And we kind of go through how to slowly let that skin get stronger. The other difference with my patients is also because of the particular dissection that we do, a lot of doctors will have the ossia programming done about a month after surgery. And that's fine if all that you do is an ossia. But again, in the, abundance of caution, I want everything healed because so much tissue was raised during the making of the ear, in addition to the ossia, that we want to let everything settle down a little longer. So we recommend a fitting for programming the ossia about 2 months after surgery.
I'm so glad you added that.
If I can add one point on the magnets as well. When Dr. Lewin orders the Osia for your child, it comes with a magnet and it's selected on the order form. You may be remembering, hey, I watched this video and Dr. Lewin said we go with a 1. How come my backpack has a strength 4 magnet in it? During the programming session, the audiologist will be able to measure what that skin flap is from the software, and it'll make a tissue recommendation. It might be a 1, it might be a 2. It might be that because of how the flap folded on that one, it's a 3. They will use what they have in their office to put in the correct magnet strength. And sometimes an audiologist will just recommend, like, hey, you know what? I have a ton of 1s in my stock. Can you order a 4 for me? I'm all out of those, right? So that might be why you have a stronger magnet in the kit. So don't worry, whatever number's in there is not necessarily the number that's going into your child's ossia.
That's a good point.
I just wanted to comment on those indicator lights quick.
Mhm.
It used to be like red and blue, and then kind of orange as I have progressed with my sons. And I'm wondering if it's now green and yellow because the Green Bay Packers won a big playoff favorite with the Cowboys.
Well, as another Wisconsinite on the call, I would say, yeah, it's probably
Okay, fine. All right.
in
we're
support
going
of the Green Bay Packers. Yeah.
All right.
But to your point, you will sometimes see the blue flashing light, which we'll talk a little bit about how Osia can stream or connect to other technology. And so you might see that blue flashing light that's letting you know that you're streaming. So think about like how we use that Bluetooth icon in our phones. It's kind of letting you know it's doing that Bluetooth streaming when you see the blue light. So the blue light's still there, just not all the time. And as far as just popping on the Osia, like I say, set it and forget it, is really what's going on in the background. So this is a kind of technical slide. It's really meant more for our audiologist brains. But really what it's trying to show you is that the Osia is very smart, and the computer inside is making all the adjustments automatically to help your child hear in different environments. So if they're in a quiet room by themselves, if they're outside on the playground, or you're at a noisy restaurant or cafeteria, it's going to automatically adapt to do the 3 things in the middle. We want to help enhance speech and make it as clear as we can. We want to reduce the background noise that they're not trying to hear, and to increase their overall comfort. So if we think about like a really loud impulse sound, like somebody dropping a plate, we want to try to minimize those loud or uncomfortable sounds as well. And all of that's happening automatically. So in the past, a child might have had different programs or settings for different environments. I think Tiffany experienced this when her son was younger, having to change different programs. And you could probably imagine how good a child would be about doing that on their own. So now they can just put it on, hear their best in these different environments, and that's all just happening in the background. It also makes it nice and easy on the audiology side. Your child will likely have probably 1 program because it's got that everyday noise reduction happening in the background. And with your Osia, you're going to receive a accessory. And this is something that you'll need to choose when they're putting together your order. So they may ask you which accessory you want. So we can talk about what are the most popular, what might make sense for your child and lifestyle. So we did make a change fairly recently that all of our pediatric patients, 18 and under, automatically receive the mini microphone here in the middle. And it's really beneficial. A lot of times, this is what a teacher could use in the classroom and wear on their shirt. And essentially, their voice would be streamed or sent directly to your child's processor, kind of regardless of where they were sitting in that classroom. It has a pretty big range. We see like coaches will wear them for different sporting events so that even if they're on the floor or the field, they can hear their coach clearly. So a lot of different uses. You can set it on the table at a restaurant, but now that's included with all of the pediatric kits, and you still get to pick one other accessory. And of course, you get the really awesome and adorable Casey the koala stuffed animal for all the pediatric orders as well. So some of your other options, of course, we're coming to you from Southern California, except for poor Tiffany, who's in the below zero temperatures in Wisconsin. We have the Aqua Kit on the left. So this is to make the Osia device waterproof. So we see this sometimes selected, especially if your child has bilateral or two devices, and they really want to be able to maintain some of their hearing benefits when they're doing water activities. So whether it's swimming, boating, but this little kind of swimsuit, you can see this clear silicone swimsuit goes around the Osia. And then usually we recommend like using the clip to clip it onto their bathing suit or to clip it into their hair so that if it does get knocked off in the water, it's not floating away into the Pacific Ocean. But the Aqua is an option. It is a significantly lower cost accessory. So it's maybe worthwhile to pick one of the other ones that comes complimentary with your kit. And if this is something you're interested in, you could always purchase it directly from Cochlear as well. I think Tiffany made a great point too. If your child, say, only wears one device, they may opt to just take their Osia off when they're doing these water activities if they have enough hearing in their other ear. So something to think about. The Osia is streaming compatible with Apple devices. So if you have, or if they're older and they have their own iPhone, or they use an iPad at school or at home, they could connect their Osia directly to those and stream the sound. So whether it's a, video or an audio book. But if you have an Android phone or device, you can still do the phone clip here, and it will make it hands-free, and you can stream the sound to an Android device. So you can absolutely still stream if, say, your child has, is older and has an Android phone. You just need that phone clip. So that's a good place to consider getting that one. And then the TV streamer, again, I'd say this would be like older kids and adults, especially bilateral. They can connect this to a TV and bring the sound directly to their ear. And again, I think a cool part about that is these all have good range. So the TV streamer, say that they're bilateral, even if they were 50 feet away in the kitchen, they'd still be able to hear the TV. Or if your child tends to watch TV loudly, then they can stream directly to their ear, and you can mute the TV so that you can have peace and quiet and they can continue watching their show. Any questions on the accessories? I know, Tiffany, you get this question a lot as far as what to choose.
Yeah, it seems like a lot of our families have chosen the water accessory, but they actually don't use it. They just kind of take it off for the unilateral patients. I think the bilateral patients, it's definitely something to consider. The mini mic, I think I'm so glad you guys include it, because that is definitely something that is useful. Like we always used it in school, but then I had a second one for home. Like when he was younger and we would bike and he would just take off and I'd be like, stop. But if it's windy and he's bilateral, like you can't hear. So it's like, I could at least be like, turn here, or let's go here. And you mentioned coaching. I wore it once during a baseball game. He said, don't ever do that again. You have no idea what you're talking about. So my husband's a high school coach. So yeah, I was like, that was the end of wearing that. But that is really great. And then the other thing with the TV, he actually can stream right into a Roku stick without an accessory. Like the technology is crazy. And if you want to know how much a teenager streams into an iPhone from, their devices, it's about 99% of any waking hours. So, The technology that
absolutely.
Cochlear does, to help these kids is incredible.
Yeah, it's very cool to see some of our patients, even with our cochlear implants, who were implanted as babies, and now they're like working adults, and what they're able to do with their technology in school or the workplace is pretty cool. So I think that's a great point too. We include a mini microphone now with pediatric orders, but you could always get a second one to have one for school, one for home, or just as a backup. So you can always get a second mini mic as well. And then the Osia app is also available. So is the app on an Apple Watch. And this is really nicer now for monitoring and maybe some fine tuning sort of control. But the goal is to just put on the device and have it do that automatic adjustments for sound. But you might go into the app, you could adjust the volume. You can see kind of in the middle here. If you did have different programs, or say you had a TV streamer, you can go in your app to activate the TV streamer. And there's some fine tuning for older kids and adults. As a parent, it's great to know that there's a Find My Osia in this app. So say that your child loses their device, or maybe it's just lost somewhere in their bedroom. There's both like a hot and cold meter that'll let you know you're getting closer if, say, their bedroom's messy and it's somewhere in there under all of their clothes, or there's like a GPS locator. If, say, it fell off at the playground, it would tell you where the last place the phone and the Osia were connected was. So it's a good feature.
It marks it. One of our patients found it in between the couch cushions because it literally found it that specific.
Yes, I've had it. My favorite one is in a toy cash register on a younger child. They like turned the house upside down and found it with the hot and cold in her toy cash register. But that's really peace of mind. And just in general, Cochlear also offers a one-time loss and damage. So if you do lose it and you can't find it, we don't charge any fee. We would replace that Osia processor at no charge. So just a little bit of extra peace of mind for you all. And then as far as some support, so we have kind of two different support teams. One is for our families who are thinking about an Osia and gathering information and educating yourselves like you are now. And that's our engagement manager team, and local to Southern California, that is Carla, who you see pictured here. She's worked closely with Dr. Lewin for several years now. She is able to connect with you all, whether it's virtually. We can connect you to another family. Say you're from out of state that lives near you, who's kind of gone through the process of an ear reconstruction and getting an Osia, to hear directly from them about the experience. So lots of good support. If you have additional questions about the Osia itself, she would be your go-to. And if needed, she can also connect you with our regional partners. We have teams in every region of the country. So say you need an early morning appointment on the East Coast and Carla hasn't clocked in yet on the West Coast, we can connect you to somebody on her team more locally. And then once you receive an Osia, we also have Rita, who she is actually a parent of a cochlear implant recipient. And so she knows our technology and our accessories very well. But she can meet virtually to do a little orientation session with you. So we have them online specifically for kids that have Osia, and she'll go through kind of how to take care of your device, how to use it, really any questions that you have. And again, she has regional partners. So if her booking times don't work for your calendar, we can get you connected to somebody local. So they couldn't be nicer humans. And they both are teachers of the deaf formally before working for Cochlear. So a strong passion for working with kids and helping them achieve their best hearing. And that's all we have. So I'll stop talking, and Tiffany or Dr. Loon, if you have any other questions.
That was awesome. And I think, this was really, really comprehensive and covered all the points that I think are really important for a parent, and maybe somewhat hard to find out about as well. Tiff, I haven't brought this up to you, but one nice follow-up we could do to this talk would be to get all of our Osia recipients in a patient panel and have that as maybe a true live chat with question and answer sessions or something like that. If there's some interest in that, maybe that would be our next venture towards helping to educate hearing solutions for our families.
Yeah, definitely.
Awesome. Well, thank you for your attention. Thank you to all of my guests today for all of your input and help with our patients. We really appreciate it. And I'll say, I love getting those videos when the Osia is activated and seeing how excited patients get. And boy, the bilateral patients who now have like hearing for the first time on both sides, it's really, like we said, it's a true game changer. So thank you all very much, and we'll see you next time.
When you ask me, how do I look? Anything I need, I say, you look beautiful, just the way you are. When you smile, the whole world stares for a while. When you ask me, how do I look? Am I pretty? I say, you look beautiful.